Runny nose and cough are major symptoms of common cold, especially during the raining season. Today on Sound Health, our focus is on managing upper respiratory tract infection. I'm Olasumbo. Thanks for staying tuned. It's still Sound Health on Lagos Television. This week we are looking at cough, and Dr. Vincent Abimbola, a consultant ear, nose and throat surgeon with the Lagos State University Teaching Hospital, will diagnose cough. Welcome to the show, doctor.
Thank you for having me.
Okay, cough is common to everybody.
Yeah.
It's one of the major symptoms of cold. What causes cough?
Having cough is a lower respiratory tract infection, and lower respiratory tract infection can, you can have infection of the lower respiratory tract from environment. Like you talk about, the flu now. Having infection in the upper airway. Infection in the upper airway can descend down and affect the chest and giving some form of cough. Okay, cough can be due to allergic problem. It can be due to infective problem. The infective can be viral, it can be bacterial, it can be fungal, and it can be due to other conditions, like which may be beyond the scope of this topic. But we are just talking about the general cough now, where a lot of people, they keep on coughing and coughing, and this cough, as I've said, may be due to just having form of infection, like a viral infection, which I've said can descend from up to the chest, and it can be due to bacterial infection as well, where you start seeing the cough becoming productive. You start seeing some productive of yellow discharge on the throat, and then again it can be due to allergy as well. You can have some cough due to allergy. So these are we have other causes of that cough, but these are the common ones that may affect patients.
Can ordinary over-the-counter cough syrups ease the pain you're going through when cough sets in?
It's not good to actually go to the counter and then get any drugs, for any disease condition. It's better to see a doctor, that the family medicine doctor, who are the first people that will attend to these conditions. So they will examine, they will take the history, they will examine, and then do possible investigations. It depends on the duration of the cough. If it's getting more than 2-3 weeks, they may have to ask for the X-ray of the chest and see whether there's any changes going on in the chest. But the best thing is that when you have your cough and it's not going after after you are taking your normal the cough syrup, some cough syrup that be able to decongest the chest, be able to make it to expect, to be able to bring down the mucus, because at times some of the mucus within the chest will be blocking the tubes, the bronch, the tubes, so that it will allow we can have some difficulty in breathing. So by the time you take some cough syrup, that if it doesn't get any relief, you don't get any relief in the next maybe 1 week, one has to see a family medicine doctor who are the first point of call to this patient. And when they see and diagnose, you can end up there. And if the cough persists, the family medicine doctor will know the right time to refer.
How true is the fact that you do not give infants, toddlers, cough syrup, that it worsens the condition?
Yeah, it's possible, because some of the children, if you give them some cough syrup, because their own airway is very narrow, and if you give any cough syrup that possibly it gets all the mucus gets stuck within the windpipe, so it's very difficult for the child to be having those infections, to be having some free breathing. So most of the time they want to avoid cough syrup in children, so that it will not give them more complications.
Okay, so what then is the solution to that kind of scenario?
Well, most of the time, if the cough if the cough is persisting now, most of the time and usually it's best for the pediatrician to see the child, for the pediatrician to see the child. And if the child, they may have to put the child on antibiotics, possibly if they think that the problem may be due to infection. But if due to the viral, they may just have to give the child some fluids, and then the child vitamins, and the child might get better.
That brings me to my next question. How do you distinguish between whooping cough, the normal cough, and tuberculosis? Because at times, some people, they'll keep coughing for the next 2 weeks and they won't go to the hospital. How would you differentiate between an harmful cough or just an ordinary cough now?
Now, if somebody is coughing and whatever he brings out from the chest, whether when it's bringing out, when it's trying to expectorate, bringing out some sputum. If the sputum is white in color, obviously not need to bother. But by the time you are seeing some form of yellow discharge from the the sputum becoming more either green or becoming yellow, or having some blood stain, one will start getting worried, especially start seeing some blood stain in it. So most of the time, like all this TB, the tuberculosis may actually, some of them may have some form of blood. You have some form of blood, in their sputum.
How best can you treat cough?
What we do in the hospital is, one, to first try to ask a proper history from the patient on the duration of the cough, and whether there's any other associated symptoms with the cough. Are they having, catarrh? Are they having sore throat? So if there's other, because you want to actually know the cause of the cough, you have to even ask for environmental history. Are they exposed to dusty environment? Are they exposed to where there's chemical? Because in this our environment, you see a lot of people, like you have some people who are baking or who are doing things, you see all the fumes in the air, and the person, people living around there keep on coming in and out of cough from time to time. So if their cough is due to allergy, you may have to tell them to, maybe, I don't know whether they're going to relocate the baker who is producing the whole year. So something has to be done so that environmental thing, which is actually precipitating the cough for the patient. Now, if it's due to the sinus condition, we try to treat, the sinus condition properly. We try to treat upper airway infection properly, so the cough may get, better. And if this patient is not getting better with the cough, and we do an X-ray, and you see that there's some features of tuberculosis in the chest, there's tuberculosis in the chest, such people are referred to the chest physician, who we now have to treat, because tuberculosis is quite with us in this environment. it's quite dangerous in this environment. So one should not rule it out until when this is being investigated and by the physician.
Okay, thank you so much, Dr. Adekoya, for sharing your thoughts with us on managing cough.
Thank you. You are welcome.
That has been Dr. Vincent Adekoya, consultant ear, nose and throat surgeon with the Lagos State University Teaching Hospital, on how to manage cough during the raining season. We bring you the concluding part next week, where we look at sore throats. Please stay with us. The program continues with trending and home essentials.
This week on Sexual and Reproductive Health Rights. Sexual and reproductive health, including family planning, is critical to the fulfillment of human rights. Family planning is widely recognized as one of the most cost-effective health interventions. Decades of research have demonstrated that modest investments in family planning can save lives and dramatically improve maternal and child health. There is a growing push in the development community to reprioritize family planning because of the cross-cutting role it plays in achieving broader development goals, including the Millennium Development Goals and poverty reduction. Most fundamentally, access to sexual and reproductive health services enables individuals and couples to plan their sexual and reproductive lives, forming an essential aspect of human dignity and freedom. As pronounced at landmark United Nations conferences on women, population and development in Cairo in 1994 and Beijing in 1995, the right to control the number, spacing and timing of one's children is fundamental to exercising reproductive rights. To do so means that individuals and couples must have the information and means to make informed decisions regarding their sexuality and reproduction. Moreover, the human right to family planning enables the exercise of other human rights, such as gender equality, for example, by allowing women to expand their life opportunities, increase their negotiating power, and raise their socio-economic status.
This is where we say thank you on today's edition of Sound Health. Hope you've learned how to stay healthy during the raining season. For comments and inquiries, please send SMS to 0035826603 or follow us on social media at LTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.